Respected faculty, dear colleagues, very good morning. I am Dr. Mohd Iqbal. I'm an interventional cardiologist working in SCIM Sora, Srinagar, in JNK. My presentation is cases on Ivus in subacute stent thrombosis. So this was a 55-year-old male who presented with risk factors of hypertension, smoking, and presented with acute retrosternal chest pain. ECG was an issue of an acute anterior wall MI. Echo showed an LAD hypokinesia with an EF of 40%. And as a routine was taken for an urgent primary PCI. So this was the angiogram that time. You can show that LAD is cut off proximally, circ looks good, and RCA looks good. So we went ahead and proceeded with the routine procedure, crossed with the wire balloon dilated with 2.5 into 12 millimeter NC. SC balloon and placed a 3 into 30 millimeters DES and post dilated with a 3.5 DES at high pressures up to 20 atmospheres. And after this, the patient goes home, everybody is happy, and we also are happy. But on day 23rd, patient again presents with acute severe chest pain, diaphoresis and hypertension, and ECG was showing an ST elevation in anterior leads again. But on inquiring, patient had been compliant to drugs. This patient was basically from Ladakh, Kargil, so he was around 400 kilometers from our center, and that place doesn't have a primary center. So we have an excellent tracking system in our state for ACS patients. We asked the local hospital to thrombolyze him and then shift him to our center. And the next day, patient comes to our center, and we're taking for an angiogram, and this is what we see. And there's, as you can appreciate, that there's a thrombus in the stent, more predominantly in the proximal part, which somehow the thrombolysis has restored some TME2 plus flow in the LAD, and the patient was relatively stable. So we did the next best thing. We gave this patient, put him on an abcimab infusion for 36 hours. And after 36 hours, this thrombus has almost all cleared, as you can see in these snares. And next, we did to understand the mechanism of this thrombosis in this subacute thrombus of this stent, we did an Ivus. But which surprised us, because we thought from the angiographic result that we had deployed it well and opposed this well, this stent. But as you can see, in the proximal part, because this may take some time to run, in the proximal part that the stent was grossly underexpanded and unopposed. There's a lot of space between the stent and the wall, vessel wall. So this was the reason for getting this subacute stent thrombus in this patient. And taking this information into account, we made a plan that we will optimize this stent. And we post-dilated this stent within 4 into 12 millimeters, because the vessel on Ivus was 4 millimeters proximally. So we dilated this, post-dilated this stent with a 4 into 12 millimeters NC balloon at 22 atmospheres. And after that, we again took an Ivus run, and we showed that stent has expanded very well in the proximal part, because distally it was already expanded well. And I'm not able to forward it. There's a long run. So after that, there was some under-expansion. Even after that, we again post-dilated it after 26 atmospheres. And then this was the final result in this patient. So the take-home message is that stent thrombosis associated with significant morbidity and mortality. and they have very high mortality as seen by as depicted by the lot of literature. And multiple factors contribute to the development of stent thrombosis. This can be patient factors, drug non-compliance, and technical, most important, the technical aspects, which is more and more coming to light after we are using a lot of imaging technology in our patients. The most commonly there's a stent under expansion and malposition. Then and that is more so common in patients who present with an ACS, because in ACS patient you want to be done with the procedure quickly if the patient is stable. And then one more important point is that intracoronary imaging has revolutionized the field of acute and chronic stent failure management. And intracoronary imaging helps in proper identification of the cause of stent failure and helps us direct appropriate management in these patients. Thank you.